Hi, good afternoon, everyone. Welcome to the webinar on the MHRA fees consultation for micro and small to medium-sized organizations. We were just waiting a couple of minutes to have all our participants join, but we'll be making a start on this presentation now. So first of all, thank you so much for joining us today. The webinar, as you know, is being recorded and it'll be published on gov.uk as a recording soon after. And the aim and the agenda on the screen is, one of our aims is to provide an overview of the fees consultation and any contextual implications in the proposals for an SME audience. We want to listen to you and use the Slido and the pre-submitted questions as an opportunity to be able to engage and answer any Q&As. And we will have a Q&A session. I will be going through the first few initial slides before passing on to my colleague, Richard. And I will cover the slides on the rationale, the approach to setting fees, and the MPM guidelines. Why are we doing this and how are we doing this? Next slide, please. Great. So we'll start with some introductions first. My name is Maha Masood, and I'm the head of planning and performance at MHRA within the finance cadre. I'm the finance policy lead for the fee uplift, and I have been a civil servant for 24 years within the finance profession. This is my third fee uplift within the government, and I've been responsible for delivering the financial forecast and the modeling. I'll pass on to Richard to do introductions and then take over the slides again.
Hello, everybody. I've been in the agency for 10 years. I'm in the innovative devices part of the agency, but I have been involved in the registration fee, which is the second option. So I'll be talking a bit about that later on. Thanks.
Thanks, Richard. Okay, so a bit more on the fees background. So when I joined MHRA, we hadn't done a fee uplift since 2016, 17, 18, which is respectively for medicines and bloods and devices for some time. So one of the tasks I was given was to establish cost to serve modeling and understand what would be the required fee uplift necessary to ensure we are cost recovering. We went through quite an intense process in 2023 to do our first uplift 2 years ago. It was successful. It went through the parliamentary debates, and the direction we had from our sponsor DHSC and the ministers was to make fee uplifts more consistent and predictable, to ensure cost recovery and to be in line with a standard practice in the regulatory world. It's only realistically possible every 2 years currently because the legislative agility isn't there, which means that it takes too long as a government process to go through the modeling, the processing, the governance, the approvals, and then the debates to ensure that a statutory instrument, which is an SI implementation, can happen. What's significantly different from 2023? We've learned so much. We ensured that wherever the weaknesses were, whether it was in our assumptions, the way we had done a holistic costing, modeling, the engagement, to ensure that we can have a sustainable model that we can then repeat rather than create everything from scratch every time we do an uplift for one of the major achievements and improvements, especially around providing more detailed evidence. We're also introducing some new fees or changing some of the way we do our existing fees. And then we were audited by our internal audit agency, and then we made sure that we implemented their recommendations to get a clean audit bill this time around on our modeling. Okay, next slide, please. Thank you. This is from me, from a finance professional point of view, a bit more to understand on how the modeling has come about, like what does cost recovery mean? So managing public money is a treasury guideline book which we have to follow and ensure taxpayers' money is being accounted and spent accurately, and we are accountable for it in our annual accounts. So what does it mean? We have to recover all our costs. There's certain type of costs we cannot recover, such as policy, enforcement, compliance. So for those, we still have to rely on DHSE or HMT to provide us funding. So if you look at the first line, how we work this out is the total team cost for the entire year, and then team transfers log. What does that mean? It means, for example, when someone is working on a licensing application, they're not people just from licensing working on that. They would be people from other parts of the agency working on them too. For example, someone from safety and surveillance, benefits risk team, etc. So previously, a lot of this work perhaps hadn't been done in a level of detail, which we have now done a lot more holistically and in a more joined up way. So those costs have been added on, and then you minus off the costs which you already get from DH. For example, for things like compliance enforcement, we wouldn't add on those costs to pass on to our customers. That takes us to a fee requirement. So that's the actual price we would charge. Underneath in the middle and the last line is more around the cost allocation. What is the cost actually made up of? So what does activity recording mean? Activity recording means that we did some demonstrative recording of people who spend time contributing to a fee earning area. We tried to understand how much does it take, how long does it take them to complete an activity. So we use that data plus their salary costs, plus any direct costs, which could be lab costs, travel costs, for example, for inspectors, but that don't apply to everybody. So this is just here as an example, if any, plus local overheads, so management times, those costs that are not directly attributed to a fee contributing activity, however, still needs to be accounted for in full cost recovery, plus corporate overheads for things like property, IT equipment, etc. That gives us the total activity cost. We're a demand-led organization, so our volumes really matter. To divide that cost, we would then divide that cost with our volume to get the fee levels. The fee level figure should be the same as the total fee requirement, and that's how we would determine the new fee price. In addition to that, for indexation, which is an increase taking into account our pay costs, we have factored in an inflationary stroke indexation element to account for covering our entire fee period from now till 2027, which is when the next fee uplift would be proposed for. And that's how we come to the figures you see in the consultation document, which is currently live on the gov.uk website. Thank you. Then, before I pass on to Richard, some of you may have seen the slides around the timeline. Again, fees is a very, fee uplifts are very driven by heavy governance processes and requirements. So we are currently in October. The consultation is currently live for the fee uplift of April 25, and it will be ending on the 24th of October. The recording of this webinar will be made available once in a couple of weeks' time, possibly, but it'll be available in October. November and December will be very busy for my team and I, because we'll be working on responding to the consultation questions, comments formally. We'll be going through a ministerial approval process for them and another sign-off following assessment of those responses. January and March is predominantly around legal requirements and ministerial preps for parliamentary debates. And then 1st of April is the go live for the consultation we have currently ongoing. Okay, thank you. This prompts me to pass on to my colleague Richard for talking and discussing the annual devices registration fees. Richard, over to you. Thank you.
Thanks, Mahan. I think we can get straight onto the next slide. Thank you. So there's been a lot of interest in this proposal, and you're probably aware that what we're proposing is that we should change our medical device registration fee into one that now relates to the number of GMDN codes that each manufacturer has. And the fee that we've calculated is £210 per GM code. So we would be able to look at your registrations on April the 1st and see how many GMDN codes you've got products under, and the charge would be based on £210 per GMDN code. The GMDN code is very convenient and practical because our workload tends to be related to product types, and GMDN is relating to product types. We'd thought about doing it against numbers of products, for example, but it's very difficult to define what a product is when there's different size packs and slight variations. And GMDN is tidier and it's more evenly spread across our teams. So we're trying to get as an equitable distribution as we can of our costs across the GMDN categories. Before we put the proposal out, we did realize that custom-made dental appliances had a preponderance of GMDN codes, which was out of proportion to the amount of work that we spend on those. So we mentioned that in the consultation as an area where we will make a special arrangement and only charge them for one GMDN. Now, since the consultation has started, we've been aware of a couple of other areas where there's these concentrations of GMDN codes. One is for IVDs, and one is for surgical instruments. So we're looking at those at the moment to see how we can modify the proposal to take into account those sort of extra concentrated clusters of GMDN codes. One thing that we're examining, for example, is the possibility of raising it a level up the hierarchy of the GMDNs to the category, one of the category levels. So we've got to do some modeling on that to see how that will work. If we do that, it's conceivable that then we will have a smaller number of items that we will be able to raise our fee against, because a number of GMDNs would be collapsing into a single number. So that may mean that we have to slightly increase the fee to fully recover the costs that we need to recover. We're doing that model at the moment. If there's any other areas where you think that this might apply, please let us know, because we are really trying to make this as fair as we can. So those are the ones that we're looking at the moment and the ones that we've picked up so far. But please, if you think there's others, let us know. Broadly speaking, and also including these changes that I've just mentioned, I think 40% on the initial calculations of people paying this fee would just be paying one fee. And they're probably most likely to be SMEs. So we were thinking in an SME context, this was not too much of a problem. But there are some SMEs higher up because of these concentrations of fees, and that's, I beg your pardon, concentration of GMDNs. So we will be looking at that. So we're keeping a very close eye on the extent to which SMEs are going to be affected by this fee. There we go. Is that it? You're on mute, Mahan.
Thank you. So that brings us with a minute to spare on the webinar. Thank you for joining us. We hope it was useful. We will be sending out a survey after the session for feedback. Just some key reminders. Consultation ends on the 24th of October. That's roughly 2 weeks from now. Please get your responses in if you haven't responded already. If you have any further questions, please contact info@mhra.gov.uk. This webinar has been recorded and will be published on gov.uk website. And just another reminder, the fee proposals that we are currently talking about, we aim to introduce them on the 1st of April 2025. And we hope that this has been communicated clearly, and we will continue to doing ongoing engagement. So we hope you are ready and preparing your businesses accordingly for the new fee uplift. Thank you very much for today. Thank you for attending.
Bye-bye.
Bye-bye.